I'll quickly introduce Miss Kalyani, who is a new member to our Galter family. She is an MBA. She is MBA from IIM Kolkata and a leading corporate and business leader. Famous artist of Karnataki music and dance. So she is multi-talented. She is new member, as I mentioned, and we are really looking forward to learn from her. And she is going to throw light on education and education piece of the budget and other areas where she is thinking that she can draw more light on. Thank you, Doctor. Thank you, Miss Kalyani. Kindly enlighten us.
Thank you so much to the entire Galter family. I'm a new member and this is my first session. I think right now India or the entire world is grappling with uncertainty. Last 10 years, I think maybe from the bubble 2008 onwards, right? There has been a lot of uncertainty all over. So this kind of budget has come. It is a very carefully selective approach, and we had a masterstroke or a landmark agreement between European Union and India. And now we have a very, very carefully selective approach agreement again with the US. So this all shows that we are very careful now. So there are not many fancy what I would say reforms or income taxes and all. It's a carefully selected approach to race ahead for 2047. So, in fact, I'm from Telangana, currently Telangana Global Business Rising Summit, which was emphasizing so much on 2047. So, I think 2047 is after independence, right? It's 100 years, and we are, rather than the 5 year plans which we had earlier, now we are looking at 2047, which is actually very good, a long term initiative. So, let me quickly come to education topic first. So this has been the highest allocation so far in 2026-27, and it is 1.39 lakh crores. And what is it covering? It is school education literacy is a major chunk, and then comes the higher education. In fact, school education is covering 83,560 crores and odd, and higher education is less, 55,727. So what I understand is, I think I've been in the West, right? I've been in UK, I've been in the US and all. There is lot of emphasis on primary education, whereas what we see is, I think there is maybe 10 years or so, there was a lot of emphasis on high school, not just high school or college education. Now, I think the good thing is we are focusing more on the primary education. So that is what I analyze Nirmala Sitharamanji or the union budget, right? There has been only from last year, there has just been a 6.5% hike for education, which is not much. And the entire percentage of education towards GDP is just 2.7%. And but the national education policy has set a target of 6%. So we are still having a long way to go to focus or improve the budget for education. Now, let us see what are the key trends, I would say. Department of School Education has gone up by, the amount has gone up by 7%, which is good. And then we are now focusing so much on AI related education, right? And the priorities are, as I have told, right? There are 14,500 plus SHRI, PM SHRI schools, and the research is through the National Research Foundation. In fact, overall, this year's
Miss
emphasis of the
Kalyani.
budget, if you see 22-23, there was a boost to Samagra Siksha. And then 23-24, it has increased to 1.12 lakh crores. 24-25, it's got an emphasis on digital driven education. And as I said, now it's a latest driven education. The emphasis is on AI. So what we are going to look at the focus areas is, there is this Narela Education City and University Townships, which the finance minister is emphasizing to build as education hubs. And then there is more focus now on Atal Tinkering Labs and AI related education. In fact, Atal Incubation Center is actually booming quite a lot. See, I go as a panelist also for Atal Incubation Center. So I know how much emphasis government has been giving for the last 3 to 4 years, which is very good. And then healthcare and education is kind of interlinked. So at least in this particular budget, they're pushing towards allied health sciences, not just the STEM, but towards the allied health sciences also, which is equally important, right? And I would be just giving a few snippets of these in higher education, where astrophysics and astronomy also they're going to emphasize on. In fact, there was one startup. So when I went as a panelist for IIM Calcutta Incubation Park, there is a very interesting startup which is observatory. So the astronomical observatory, and that startup has come for funding. So in fact, that actually, so they are focusing a lot more on these observatories, astronomical experiences, which will be a good education for students. So that's something very, very interesting, a pretty niche one. And then they're proposing, when it comes to the tax rates, they're proposing to reduce the TCS rate for pursuing education under the liberalized remittance scheme from 5% to 2%. It's been reduced. Now let's come to health. So here, once again, the Ministry of Health and Family Welfare has been allocated one, and this has actually gone up by more than, I mean, roughly 10%, which is actually fantastic. So they have this year's budget. There is a lot of priority to the health sector. See, we are having these lifestyle related illnesses. If you see diabetes, right, heart stroke, a lot of obesity related ones. So I'm so glad that the government has focused, by increasing the budget on health by around 10%. Now, what we can see is here, the important programs are Pradhan Mantri Jan Arogya Yojana. That allocation has been increased. And when you see even the National Health Mission, which is for primary healthcare centers, maternal and child health services, that is also allocation has been increased. And uh, we would say there is this Pradhan Mantri Swasthya Suraksha Yojana also, and that allocation also has been increased. And there is an operationalization of new aims. There's which is actually pretty once again good. And in the area of disease control, they are allocating more funds for National AIDS and STD Control Program. And there is also digital healthcare transformation, which is the Ayushman Bharat Digital Mission. So when you see right over the years how much importance has digital transformation occurred in the health sector, if you see medical transcription, if you see medical records, everything, I think digital transformation, they have given a lot of importance, and that's how Ayushman Bharat Digital Mission has taken up a big way. And there is also higher allocation for institutions like AIMS Delhi, PGIMR Chandigarh, central hospitals, and the central government health scheme. So the moment people say government hospitals, a certain kind of picture comes to us. Not a very, very bright picture when you compare it with the corporate hospitals, right? But there is a whole lot of, I would say, an entire population depending on these premier institutes, and you'll be surprised the kind of workload that doctors handle. There are certain diseases which only the central the hospitals and AIMS Delhi can tackle. So we should not be looking down upon those. We should be strengthening these kind of premier institutes. The infrastructure I'm talking, the doctors per se are excellent, I would say. They're one the best brains in the country are actually working in AIMS Delhi and all of these premier institutions, right? And I would say there is this Biopharma Shakti initiative that has been given 10,000 crores to boost domestic production of biologics and biosimilars. So this is actually gearing up to the global biopharma. Uh, I think overall, right, they are now also focusing on mental health care, which was not a priority earlier. So they're strengthening and establishing one more NIMHANS in North India, which is pretty good. And as you see, right, we have very good infrastructure of roads. Once there are wide lane roads, the speed of, the vehicles also goes up. And that is where we need emergency and trauma care centers. So if you could see, in fact, in the recent past, a lot of VIPs have, I'm not talking of every life is precious, but VIP's life comes in the headlines, right? Every life is precious. So I don't know, they are now giving a lot of importance to these emergency and trauma care centers in every district hospital, which is fantastic because there is something called golden hour. In the very few minutes once an accident occurs, it is so important to take, the person to a hospital. So that is where I'm looking, at the budget, the importance of it. So they are going to establish 5 regional medical hubs and increase the emergency and trauma present capacity by about 50%. And then, as I've mentioned, NIMHANS 2 will be there in North India, and there'll be upgrades at Ranchi and Tezpur are also being planned. I've already spoken about allied healthcare professionals. Overall, it's a strong care ecosystem, which I think the union budget is looking to build. And then they're also going to talk about Ayush. So they're setting up 3 new All India Institutes of Ayurveda and upgrade all these pharmacies of Ayush and all. Overall, I think there has been an increase of allocation in education and healthcare, which is a very good initiative taken by the government. Thank you.